When we talk about mental health, the topic of antidepressants often comes up. But what are they, really? At their core, antidepressants are a class of medications designed to help relieve the symptoms of depression. Depression is a serious and often debilitating mood disorder. Think of them not as happy pills that create artificial joy, but as tools that can help rebalance the chemical environment of the brain. These medications are typically prescribed by a medical doctor or a psychiatrist after a thorough evaluation. They are used to treat moderate to severe depression. They are used to treat anxiety disorders, obsessive-compulsive disorder, and post-traumatic stress disorder. The journey of antidepressants began decades ago, evolving significantly over time. The first generation had a broad impact and a long list of side effects. Today, more targeted drugs like SSRIs are common. This specificity is key to their modern use. They are not a quick fix. They work gradually over weeks or even months. This stability allows individuals to better engage with their lives and therapy. Their function is to provide a biological foundation upon which psychological healing can be built, not to erase life's challenges. Differentiate antidepressants from recreational substances. Unlike recreational highs, they are for consistent, long-term use under medical supervision. They do not produce euphoria. Their effect is subtle, a gradual lifting of the heavy fog of depression. This allows people to regain interest in activities they once enjoyed. It helps them feel more like themselves. They help people find the energy to tackle root causes through therapy and lifestyle. And they work best as part of a broader plan including social support. View them as one component of a multifaceted approach. To understand how antidepressants work, we need to look inside the brain. Your brain is made up of billions of nerve cells called neurons. They communicate using chemical messengers known as neurotransmitters: serotonin, norepinephrine, dopamine. In depression, the communication system may not function optimally. There might be lower levels of these chemicals in the synapse, making signaling harder. Antidepressants, especially SSRIs, influence this system. Selective serotonin reuptake inhibitor, the name tells you what it does. After serotonin is released, it is normally reabsorbed into the presynaptic neuron. SSRIs block that reuptake, leaving more serotonin in the synapse. It's like turning up the volume on a quiet conversation. This process does not happen overnight. It takes weeks. Over weeks, the brain adapts. Sustained signaling encourages neuroplasticity. New connections form. It can even promote neurogenesis. New neurons sprouting. Mood-related circuits strengthen, aiding regulation and cognitive function. This is a simplified model. Depression is complex. Genetics, environment, and psychology all matter. But robust clinical data show modulating these systems can be therapeutic. Antidepressants initiate cascades that restore mood regulation, a biological platform for recovery. One of the most significant benefits of antidepressants is their proven ability to reduce the core symptoms of major depression. For many, depression is more than sadness, anhedonia, loss of pleasure, low energy, overwhelming feelings of worthlessness. Randomized controlled trials show antidepressants outperform placebo in moderate to severe depression. That relief can be life-changing. Getting out of bed, reconnecting with loved ones, improved focus and energy follow. They can also enhance psychotherapy by stabilizing mood enough to engage in therapy. In severe episodes, people may lack motivation, energy, or clarity to do therapy work. Medication can provide the foundation for psychological healing. Beyond mood, antidepressants can improve sleep, appetite, and activity. They can help regulate disturbed sleep patterns and normalize appetite for many. For some people, antidepressants can be life-saving. Severe depression is a major suicide risk factor. Reducing unbearable symptoms can reduce suicidal ideation. Despite benefits, antidepressants are not without drawbacks. It's crucial to view potential side effects clearly. Altering brain chemistry can affect other body systems. Especially in the first few weeks, common side effects include nausea, headaches, dizziness, changes in sleep, insomnia, or excessive drowsiness are common, often temporary but unpleasant and sometimes discouraging. Some stop treatment prematurely because of these effects. A particularly challenging category involves sexual health, decrease in libido, difficulty achieving orgasm or arousal. Talk to your doctor. They can adjust dose, switch meds, or add another medication. There are strategies clinicians can try, but sexual side effects can seriously impact quality of life. Some people experience emotional blunting, lows lifted but highs dampened. Emotional range may feel compressed. Feeling flat or numb can interfere with identity and relationships. Some experience treatment tachyphylaxis. A drug that once worked may lose effect. Symptoms can return even on the same dose. The brain may adapt. Reasons aren't fully known. Common responses are increasing dose, switching drugs, or augmenting. It's often a frustrating, lengthy trial-and-error process. That can be disheartening, especially amid depression. Depression is heterogeneous. Genetics, life experience, and environment all play roles. Genes affect drug metabolism and neurotransmitter function. Some metabolize drugs too fast or too slow. Pharmacogenomic testing can help in treatment-resistant cases. Finding the right medication is a collaborative, often individualized process. Consider symptoms, medical history, and tolerance for side effects. For some, relief outweighs risk. For others, lifestyle or therapy first is appropriate. There's no single right answer. The best path is tailored to the individual. For some, the answer is yes. For others, a combination approach works better. Just as starting requires adjustment, stopping an antidepressant does too. It is critically important these medications should not be stopped abruptly. Sudden cessation can cause discontinuation syndrome. Symptoms can be mistaken for relapse but are physiological. Dizziness, nausea, fatigue, muscle aches and irritability, anxiety and vivid dreams. This is not addiction but physical dependence. Severity varies by drug, dose, and duration of use. Medications with shorter half-lives often cause stronger withdrawal effects. Paroxetine and venlafaxine are examples often linked to stronger discontinuation symptoms. By contrast, fluoxetine, Prozac, has a long half-life and milder syndrome. Understanding half-life helps clinicians plan cessation. The recommended approach is a slow, gradual taper supervised by a doctor. Reduce the dose in small increments over weeks or months. Some people taper over months, some need even longer. Slow reduction gives the brain time to readapt. Tapering plans must be individualized. Some need prolonged tapering. Long-term users may need especially cautious schedules. Work closely with your clinician on a stop strategy. For recurrent severe depression, long-term or lifelong treatment may be safest. For others, medication is temporary support while developing coping skills, then taper off safely. In summary, antidepressants are a powerful and important tool in treating depression and other mental health conditions, but they are not a universal cure. They modulate neurotransmitter systems and initiate neuroplastic changes. That cascade can alleviate debilitating symptoms for many, allowing people to reclaim life from illness. However, they come with trade-offs, side effects, emotional blunting, and dependence. They don't work for everyone. The trial and error process can frustrate, and physical dependence requires careful tapering under medical supervision. Antidepressants are one component of a comprehensive strategy. Psychotherapy, exercise, mindfulness, and nutrition matter too. They don't teach coping skills or fix life circumstances by themselves. Deciding to take an antidepressant is personal. Weigh benefits versus risks with your doctor. Consider your biology, symptom severity, and treatment goals. Make the decision collaboratively with your clinician. For some, antidepressants are life-changing. For others, non-medication strategies or combined approaches work best. There's no single truth, only the path that's right for you. If you or someone is in crisis, contact local emergency services or a crisis hotline. Talk to a clinician for personalized advice. If this video helped, like and subscribe for more science-made simple explainers. Remember, antidepressants are a powerful tool when used thoughtfully. Consult your clinician to find the right path.